Oh. Captain Skype, you're up. Oh, no. Yeah. Okay, where do I go? Up in front?
Told you up front,
One way or another, right, Mr. Supervisor?
front of the bus, front of the class. It's a trend.
Good afternoon, everybody. Kevin Skype from the Sheriff's Office. The first request that the sheriff is asking for is authorization to fill a vacant, already budgeted corporal's position as a corrections officer in the jail. The original employee in that position didn't make it through the probationary period, so we'd just like to move forward with putting someone else in that position.
Do you have somebody in mind for in place for it?
There have not been interviews done yet that I'm aware of, but it would certainly come from within.
I'll move it.
Second. All in favor?
Aye.
Opposed? Carried. Next, the sheriff is looking to authorize, for authorization to create and fill a full-time corrections officer. This is in lieu of someone who resigned. So this is already a budgeted full-time. So I get not creating, but I misspoke.
Oh, that was gonna be my question, because at the top it says create and fill, but in the description it just says to fill, so we're not creating and filling.
We're not creating,
Okay.
just filling a vacated spot.
That's a 40-hour-a-week position.
Yes, ma'am.
I'll move that with the amendment that we're not creating.
Second.
You second, all in favor?
Aye.
Opposed? Carried. Okay, so the sheriff is also looking for authorization to fill a full-time communications officer. Now, it's a spot that we already, it's already in the budget. There's an individual that's in that position now, who just recently, I think within this week, the beginning of the week, notified the sheriff that he would be most likely moving on. So we're just trying to get ahead of the game, based off of course, our staffing issues.
You had, I think we approved for a communication officer sergeant,
Yes,
and
sir.
then this position was to leave. That was the understanding that I had, that they were gonna get rid of this position and leave just communications sergeant. Am I
Well,
right?
last month, we approved the creation of the position, a kind of pre-fill for someone leaving. Is that the one that we created that?
No, that position actually, he just started this week in that position. We filled that position. This position that he's requesting today is a current communications officer.
Did the
Who is
person
taking-
leave who we created the position for last month?
I'm sorry, I didn't
Did
get
the
you.
person leave who we created a position for last month?
No, that was a new position.
Yeah, but that was new only to train someone until someone who was leaving was leaving.
That's what I thought.
You know what I'm saying?
I
I was under the understanding that once we approved the sergeant's position, that the sergeant, when
Well, the sergeant's next.
when the person is promoted, though, that's when he's gonna get rid of the position.
Was this being filled by part-time people right now to make up the difference?
we do utilize part-timers,
That's what I was gonna
when
say
we're
was-
able to.
Is this supposed to fill to the end of this year? It would.
Yeah, I'm just, the one we created one last month. You have someone in that. And what the agreement was that when the next person left, that position would go away. We wouldn't fill that position.
I don't have any knowledge of that, so the sheriff didn't mention that, so I apologize.
This
but
might be a different person leaving in the fund. We're back to it.
This would be backfilling his position when he goes and moves on to his new endeavors.
And this person leaving wasn't known about when we created the new position, so I have to assume that they're different. But in public safety, I think we should follow up with the sheriff that one that got promoted, that vacancy got.
So if it helps, if I may, excuse me, Supervisor, didn't mean to interrupt.
No, go ahead.
What may be confusing here, and just correct me if I'm wrong, but the sheriff was looking to upgrade a communications officer to the position of sergeant. So once that happens, we would not be backfilling that
That's a
position.
23.
That would be in the new budget.
We'll just, I guess we'll clarify it.
I do have one question. So the salary of the starting position is the 48,000. Is this position budgeted? Yes, the amount 67. That's why it's the 19,000. That's how much the longevity, the person being in the position for so long was 19,000 more.
There would be steps in longevity.
Okay, so the new one is the 48,000.
Yes. We're still in the steps, right? We have.
Yes, the only steps that were negotiated out with UPS are the contracts also have their steps in place.
Can I bring up an issue that I brought up last meeting? Our department heads, can I show of hands? Any of you do exit interviews at all? So we, the county supervisors, DSS, shouldn't we mandate that? So we have a better handle on why people are resigning. You're gonna see that word over and over, filling these point ones, and probably from here on in. And we, it would be nice to have a little summary of why people are resigning. Don't have to be detailed. Just say, why are they resigning? Is it another job or just didn't like it, whatever, didn't like the boss?
Yeah.
But I think that would be very helpful to all of us.
We do exit interviews and it's in the contract at the request of the employee. That's how it's written.
So it's in the
I think I
contract.
heard, I'll take your word for it. What you said.
No, it's fine. I mean.
I
we-
couldn't hear.
No, I said it's in the contract at the request of the employee, so we
Oh.
can certainly conduct them.
Would it be a heavy lift on your office to do exit interviews every time an employee leaves employment?
I would say so.
Yeah.
But
Well, because I'm wondering,
depending
and
on
Bob,
what
I'm gonna use you as an
information
example, because I'm
gather.
sure you're a fabulous boss, but if I was leaving because I didn't like my boss and my boss was the one conducting the exit interview, I might not be frank and honest about it, whereas if Michael or someone from her team was conducting that, I might be like, you know what?
I say so.
My boss doesn't let me go to the bathroom and I need to go to the bathroom, and that, again, I'm using extreme examples, but I almost think that makes more
Chairman.
sense.
Chairman,
If I may, to your question, I think most of the department heads could gather that information. It's usually communicated or known as to why the employee is moving on. Most employees are comfortable stating that. But to perform a specific, what you're calling an exit interview, I've always thought that's contraindicated.
maybe a synopsis, just like you're saying, just a quick,
Right, supervisor does even,
simple.
it's, at previous employers, it was HR that, served in that capacity for the reasons that Supervisor Hoagland just mentioned. Sorry, Michael.
It wouldn't be a problem.
It's something we can explore.
Yeah, again, it doesn't have to be detailed, and probably you're not gonna get much cooperation from the person that does resign. But even if they wanna, give them a, questionnaire or a piece of paper with 5 reasons they're leaving and what can the county do better or anything like that, it might help us.
Could even be like a Survey Monkey or Google Sheets kind of thing, that if they don't want to do it, they don't do it, but we give them the option. to
Yeah.
just do that.
And what we could do those, if we want to notify staff and or department heads, we would also need to notify the department heads then that they need to notify us of their resignations, not, their last day of work was last Tuesday and here's their paperwork. So in order for us to accommodate that, we would need to know when people were leaving, their actual day, in order to accommodate doing that ahead of time. So we could certainly do that.
I have to say, it's not been my experience that they hold back. And I have somebody in a designated role to do it.
Yeah.
Position was created for that. It's just been not that anybody's been necessarily upset with me, but there are a lot of levels of report.
Yeah.
In my agency, and when it's been necessary, they've been able to communicate. I didn't appreciate that level of support, or I didn't. So I think you find there is more honesty than that. I think you'll also find money, other jobs, and modernity are now. When I say modernity, there's new technologies out there I'm getting killed with because I'm not.
Really?
Yep.
But I think that's all
I get to
really,
hear about it every day.
that's all really important and useful feedback to us as supervisors who set things like pay and maybe get you not maternity, I assume.
No, maternity, they're quite happy.
Okay.
I attempted maternity, next thing I know, I saw somebody in the newspaper,
Oh,
so be careful.
I'm not saying I'm going to institute, it, I'm saying this is what's brought.
I'm not in the loop, I never heard that. All right,
Thank you.
Okay,
I'll move the resolution in front of us.
I'll second it.
all in favor?
Aye.
Aye.
Opposed? Carried.
See what you started, Kevin? Jeez. With that,
When that goes on though, I'd like to just take and talk about that, just to clarify that a little bit.
Right, just in the next committee, if they could just clarify that.
We can just
My
clarify.
understanding was that it was gonna be, yeah,
Just like you.
so.
Okay. So lastly, the sheriff would like to abolish the full-time registered nurses position at the jail. And this is due to the implementation of the new medical vendor, and the individual leaving, I think, actually signed on to work with this vendor. So that's
I'll move that.
Second.
All in favor?
Aye.
Aye.
Opposed?
I do have one quick clerical question. Shouldn't the net difference at the bottom be in parentheses because it's a savings of 65,000, not an increase? Typically, when that's a savings, it's in parentheses. It says saving, like the last one was a savings of 19. Because if we're abolishing the position, aren't we saving 65,000? Do you mind, Kelly, just adjusting that? Thanks.
Hey,
I don't have
Thank you, sir.
anything else, Mr. Chairman. Thank you.
Thank you.
Thank you, Captain.
Supervisors, I appreciate your time.
Dana Rossi. Human Services.
Good afternoon, everybody. What you have in front of you is a resolution for a create and fill, with the understanding that we would be dissolving a position known as the Twin Counties hybrid position. We're going to be taking the funds that supported that position and using it to cover this proposed position. From what I understand, it should pretty much balance out in terms of the overall amounts.
And you're looking for this to become effective 2023.
That's in discussion. We can definitely opt to go that route, or since there's such a minimal amount of time left, Joe Ambrose would be speaking with Jim Breed, the controller, to figure out what we would need to tap into. We have, as you know, several vacant positions within the Department of Human Services that we could draw from to tap into in terms of the monies.
Yeah, if they want to put that to do. If they get a candidate, I think they should jump on it.
Okay, I'll move it.
Second.
Thank you.
All in favor?
Aye.
Aye.
Opposed? Carried.
Much appreciated.
Public Health, Jack Mann.
Okay, we have two service coordinators in our early intervention program. One resigned after many years of service, indicating that the job was no longer her thing. And I would say by and large, when we get a resignation, they do tell us why they're going. It's pretty much by and large. So she just decided it wasn't her thing. Critical, they carry caseloads of 30 to 40 children. So it's critical that we serve this. So I would like to fill. But move it.
I'll second.
All in favor?
Aye.
Opposed? Carried.
And I also was told I should mention that I'm going to seek a 30-day emergency fill on this because how critical a position it is at my home committee. Next personnel resolution is related to our hearing officer who has been under contract. The county hired him. He's now working for the county, part-time apparently, and you can't be a contract employee and a part-time employee. So we're going to have to make him a part-time employee.
This is per diem.
You mean full-time?
No, he's not going to be full. He's very part-time with us. He's our TUPA hearing officer. So when we have a tobacco sting, and somebody sells, then he comes in probably on average of, 6 times a year kind of thing. So he's gonna be very part-time with us.
I'll move that.
Second.
All in favor?
Aye.
Opposed? Carried. Thanks, Jeff.
Because you're gonna ask for Aaron Judge.
Commissioner Gibson.
So you're gonna ask for Aaron Judge.
Yeah.
Oh my God, look at that book.
Wrote the thick book because he has a lot to ask.
So, good afternoon. My first request is to fill one principal social welfare examiner position, grade 16A, base salary 61,703. And any backfills created therefrom, that is actually a resignation and someone moving. So, and retirement.
All in favor?
Aye.
Opposed?
Kelly, I think this one too needs to be in parentheses because of the savings for 1,500.
This is our longevity.
The second request, authorization to fill 2 senior social welfare examiner positions at grade 14, 53,245, and any backfills created therefrom.
We have it as 2
Yeah,
different
we have it as one.
resolutions.
Okay,
We have 2 resolutions in a row, each to fill
for a
one.
senior,
Yeah,
okay.
So you.
So I can separate
No, you
those.
can do them both. You
Yeah.
can do both.
I'll move it.
Second.
All in favor?
Aye.
Opposed? Carried. So
Uh,
you go on to the caseworker.
Yeah, I'll go on to the caseworker position. To 15 at 56,999 and any backfills created therefrom.
I'll move it.
Second.
All in favor?
Aye.
Opposed? Carried.
And one social welfare examiner position 12A, 46,662 and any backfills created
I'll
therefrom.
move it.
Second.
All in favor?
Aye.
Did you get any, on the resignation?
So after the top one, which is principal, and she retired and she's moving on, that's everybody moving on for another job.
In the area or not?
State, mostly,
Is it a pay?
pay and other things.
Conditions of employment.
No, actually, nobody complained about anything like that, but, I didn't say that. You said that.
Thank you.
Thank you.
Thank you, folks.
Okay, next we have, the county attorney who I told him we would handle it. The county attorney has a part-time attorney's position in his department. He'd like to fill it. He has an individual who used to work for the public defender's office full-time, wants to be part-time. There's things that have changed in the law, like the extreme order of protection. Now, the county attorney's office has been very, very busy holding hearings regarding it. So he'd like to fill that position. It's been budgeted. He hasn't filled it for a while, purposely, but the money is.
Jim moved it, I'll second it.
All in favor?
Aye.
Opposed? Carried. And Vinny, least but not last. The last but not least.
I gotta find.
Okay.
Good afternoon.
Good afternoon.
I'm looking to convert a vacant budgeted probation assistant position to a paralegal position and fill that position. We've had the vacancy for a number of years, and the difference is about $10,000 increase from assistant to paralegal. And I believe it's going to give us more flexibility in the department with what we can do. And part of the plan is to increase our services to victims.
And the money's in your budget to be found from elsewhere.
Yeah, definitely.
And is it in your 2023 request for the new position with the higher rate? Do we know?
I think the request,
Yeah, I mean, the plan is we'd be filling it around the first of the year, probably,
How long hasn't this position been filled?
ever since I've been director, so like 6 years at least.
I'll move it.
And
And
what's,
you've asked for it every year?
I've never asked, well, we asked for it and then COVID hit, so it got pulled back, so.
I'll second it.
I think the chairman had a question.
Is there a list?
There isn't.
There isn't?
There isn't currently. We ordered the exam already, and my guess is last time no one came to take it, though we had several sign up. If that happens again, we're gonna go to the state to change its classification.
and again, you said you had in your budget, you have the money to cover it.
Yes,
So we have a motion and a second. All in favor?
Aye.
Opposed? Carried.
thank you.
See, you need to eat everybody else up. It's good going, Lance.
Any other business? Motion to adjourn? Motion.
Second.
All in favor?
Aye.
Opposed? You're on time.
Barely. I just had a fabulous meeting down at Columbia Green. Remember when Carly Drummer was here talking about the tiny home building
Yeah.
department that they had? Well, we're working on housing in New Lebanon, so I was like, hey, can we like get your tiny homes that your students make?
We had a presentation in front of
You have.
Public Works, and they were so expensive, they were the company that gave presentations. Brass tacks was like 40,000.
The students are now looking at and entertaining out of us the reason.
So we.
I know, you get to go home and watch it. That's why I said to Matt, can we
Order Tuesday, October 18th, 2022. We'll start with Mr. Kevin McDonald. Step right up, sir.
Hurry up, your uncle's on.
Feel free to give us any updates.
Oh, you thought I was looking at the agenda? Yeah.
Okay, first thing I have is a request permission to contract with the Healthcare Consortium to provide assistance to seniors who have had critical needs resulting from the COVID-19 pandemic in the amount of $14,828.
I'll move it.
Okay.
Any further discussion? All in favor?
Aye.
Can we hold one sec there? Please.
There's an echo here. Do you hear that?
I know that's, I'm trying to get rid of it. I can't figure out why.
You say hi, Mr. Gibson. Forgive me. Dan.
Sorry, Kevin, just be a minute.
Okay. Okay, second resolution
No,
is,
hold on.
nope,
I said it'd just be a minute.
can't hear.
What happened?
Okay. You're good to go.
Okay, my second resolution is authorization to renew a number of contracts which are attached for next year. These contracts are, several of them are with the home care agencies that we contract with as far as providing aid services, in addition to our own home care aides. It's also contracts with various towns where we house our nutrition sites. And it's also with our legal contract for our attorney, contract with the Healthcare Consortium to provide transportation, a contract with the Health Department to provide Tai Chi services, and a contract with our dietitian.
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Okay, and then, attached is our our quarterly report. The only changes to that was just updated this morning as far as the Everhome Columbia project. The open cases, it's not 12, it's 13. And they have 12 cases that are in various stages of opening. So it's starting to move a little bit better than where we're at. I know that they have a number of presentations scheduled. I think tomorrow they're going to be up in the northern end of the county with Canaan and New Lebanon. So, and I believe they've recently been down to Providence Hall for a presentation. So,
Kevin, last time they were here, they presented, we asked them to send out information to all the towns. Never got it.
because I thought the article that they did for the chairman's corner, I thought that went to all the supervisors. It didn't?
It did.
Well, I thought they were gonna send us something that
Oh.
we could put like up on our websites or some.
I'll ask them that.
I mean,
I'll see them.
anything we can help with, but I think it's
Okay.
gotta be ready to go, you know what I mean, that we can post it.
Okay, I'll do it, because there's something on the town of Copake's website about it. That's why I thought maybe it came from that, the chairman's corner thing, but now I'll certainly speak with them about that and make sure they reach out to everybody. So. That's all I have.
Any questions for Director McDonald? Thank you very much, sir.
Okay, thank you.
Up next, Mr. Mad, Department of Health.
Hi, Jack. How are you?
Right, happy, how are you?
Very good, thanks.
Okay. All set?
Yep.
So the first resolution went to point one. A little while ago, we have two service coordinators serving our early intervention program. One resigned. They carry caseloads of 30 to 40. They're pretty critical people. And I'd like to fill that position. And I'm also asking for an emergency fill so that we at least can post for it and maybe perhaps begin interviews.
Move it.
Second.
Discussion, all in favor?
Aye.
Opposed? Carried.
Second resolution, we have a hearing officer for our tobacco program. Somebody sells cigarettes, they come in for a hearing and probably there 5-6 times a year. He's great. We like to keep him. The county hired him. He's now working for the county. You can't be a consultant, contract person, and an employee at the same time. So we are going to pay him as an employee. And so I'd like to be able to fill one per diem hearing officer.
I'm sorry, Jeff, what does he do?
Tobacco stinks. So
Okay.
we send teens in and if they sell, we have a hearing and
I'll move it.
Second.
Discussion, all in favor?
Aye.
Opposed? Carried.
one of our Board of Health members, Marcia Fabiano, is up for her 6-year reappointment. She'd like to continue. We would like her to continue, so I'd like to reappoint her to the Board of Health.
Move it.
Second.
Discussion, all in favor? Aye. Opposed? Carried.
Next is a resolution. We're one of the few counties around, and I'm very proud of this, and I have to give all the credit in the world to Liz for this. We have affiliate agreements with colleges and universities that teach student nurses. They can come here and they can fulfill their requirements, and this is just to renew those affiliate agreements.
Move it.
Second.
Further discussion, all in favor?
Aye.
Opposed? Carried.
This is going really easily here. The next two resolutions have to do with contracts that we have for services. A lot of it is early intervention and different grants. And you can see on the list our grants. I guess we'll handle them differently, separately here. The one for early intervention is services, as well as our nurse practitioner serves our clinic, and Fairweather, who inspects our pharmacy once a year. And James McGinnis, who services our gratis. So these are annual contracts that we just sort of automatically renew. We're looking to automatically renew.
Move it.
Second.
Discussion, all in favor?
Aye.
Opposed? Carried.
And the last resolution is for a list of grants that we have to renew on an annual basis. Healing Community Study, ELC grants for the HRI with the state. It's just, again, they're just sort of routine contracts that we have to renew on an annual basis.
Move it. Second.
Discussion, all in favor?
Aye.
Opposed? Carried. Any questions for Mr. Matt? Mr. Matt, did I cut you off? Were you gonna say?
No, I was just going to say, that's what I was going to, emulate Kevin and say, that's all I got. And if there's any questions, and, the health report is here. And
So looking at the winter's trends, if you start feeling symptoms, stay home, right?
yeah, as we were discussing before, something like only 5% of the people who are eligible for the bivalent booster have gotten their booster. That's really scares me because I think we're in for a hell of a winter between the flu and COVID. I think we're going to see a lot of positive cases.
So if you've had the COVID of recent, you should wait 3 months before you have the bivalent booster?
They're not saying anymore that you need to do that.
Okay.
They're saying you can do it sooner than that. And part of that is that we've had a few employees in the health department who had COVID and in less than 2 months got it again. So with these new variants, they're not sticking to that 90-day thing that you don't have any grace.
Okay.
So I wouldn't get it right on top of having COVID. I would wait a month or 6 weeks maybe, but I'd still get it.
Okay.
Jack, are people getting both the COVID and the flu shot?
The numbers are down for us in terms of how many we give out at our various drive-ups. Certainly everybody, CDC and FDA is encouraging people to get both.
There was a line at CVS for flu shots. I went there and I had it's pretty long.
I'm glad to hear
A
that.
lot of people that I spoke to said that they were waiting until the end of October to get the flu shot. And
Well, the science there is that your immunity wanes after a while, and initially they said if you get it in September, then you're still gonna be in flu season and your immunity is gonna wane on you. But at the same time, in our circle, in my family circle, friends and whatever, I've had several people who really sick and kept testing negative for COVID. They had the flu. I think it's been here. I think it's already here.
How did we do with the vaccination clinic in the lobby at 325 county employees, Jack?
I think we did 26 or 27, not a huge number, smaller than years past.
Are you at AB Shaw in November or?
Yes, we're going to continue right into November at AB Shaw.
So I was just gonna say, in Chatham, Price Chopper and Walgreens, which are the two available sources for vaccinations, are only doing them by appointment. They were both out in November last week. So because Price Chopper does 6 to 12 a day, period, and you have to make an appointment. Walgreens would not tell me how many they do a day, but they were out in November in terms of calendar. So if somebody wants to wait till the end of October, they need to get on the list now.
this is for the flu shot.
No, it's for either. It's any vaccination, whether it's COVID, shingles, flu, whatever. Their Price Chopper's doing 6 to 12 a day based on their staff, period.
Some primary health providers are having a walk-in, like my primary health care provider in Chatham. They had someone in the lobby, a technician, you just walked in, you got a free shot, you left your name and that was it.
So maybe if we're doing any kind of public health announcements, we should make note of the fact that, making an appointment could mean an extended delay to get a vaccine, and it might push people to our clinics, is all I'm thinking.
And we're gonna continue at AB Shaw right through November, Thursdays from 3 to 5:30. And we've been busy, not crazy busy. But I would also say for the last couple of years, we've done a drive-up clinic at Columbia Green. And it was a pretty crappy day weather-wise. In the past, we've done well over 100 in that drive-up. We did 8
Whoa.
2 Saturdays ago. It just wasn't really, people just didn't turn out for it.
Are you doing the bivalents too? Are you
Yes.
doing those?
We're not doing drive-up on the bivalents. We're doing them at AB Shaw. But this was a
Maybe sure.
drive-up flu clinic at the college. People just didn't turn out.
Wednesday, be sure.
Thursday.
Thursdays from 3 to 5:30.
Thank you.
And I went last week and I was in and out in 10 minutes. I mean, really, by the time I took my coat off, sat down and got up now, so.
And
Amy Shaw.
Yeah, that's what we want.
we do put up links and you can sign up. It just saves you on the paperwork. You can also just show up and get a shot.
And the report from the schools, I mean, how are things going there?
Schools, New Lebanon had the first week of school, their elementary got hit pretty heavy, like 15 kids. The other schools are just sporadic. It's very sporadic. And a driver here, an aide here, it's more of the adults rather than the kids.
That's been out in the press, Jack, when you're out at AB Shaw.
Yeah, we put it out and it's always in the chairman's release as well.
Any more questions for Jack Match? Thank you so much, sir.
Okay.
Do you want me to sign that?
Yeah, that'd be great.
Up next, we have Commissioner Gibson, Department of Social Services.
Brenda.
Maybe sure.
Yeah, yeah. You like it, Clover?
Yeah.
Take care, Jack.
See ya.
Good afternoon. My first request is to fill one principal social welfare examiner position. Was just approved in .1 prior to this meeting.
I'll move it.
Second.
Discussion? All in favor?
Aye.
Opposed? Carried.
I'd like to combine the next two into one request. It's a request to fill 2 senior social welfare examiners at grade 14, also approved at .1 prior to this meeting.
Move it.
Second.
Discussion? All in favor?
Aye.
Opposed? Carried.
Also a request to fill 1 caseworker position, grade 15,
and any, okay, I should back up. Kelly, I think that they all mentioned any backfills created therefrom. I did not say that out loud, but the resolutions.
Yeah. they have it on it,
Very
yeah.
good. Request to fill one caseworker position, grade 15, and any backfills created therefrom.
Have a motion?
Move it.
Discussion? All in favor?
Aye.
Opposed? Carried.
And request to fill one social welfare examiner position, grade 12A, and any backfills created therefrom.
Move
Do I have a second?
Second.
Discussion? All in favor?
Aye.
Opposed? Carried.
Okay, also I have a request to enter into an agreement with Tara Benacasi. She's an LMHC and an NCC. She would provide sexual abuse evaluations on a per diem basis when needed.
Move it.
Discussion? All in favor?
Aye.
Opposed? Carried.
Also, I have sent down in an electronic file, and I can provide to anyone our list of contracts to be renewed. We do our annual list now, so they can be viewed anytime. If any supervisor has any trouble with that, just let us know. We can send it to you in mass.
I'll move it.
Do I have a second? Is that you, Abdu? Second. Discussion? All in favor?
Aye.
Opposed? Carried.
Mr. Chairman, we had spoke yesterday. I don't know how you would like to proceed to have a discussion. We can hold it off till the end. We can go into executive. We could take it up at another time.
Mr. Chairman, this discussion was revolving around the youth director position. Would you prefer to have this for a special committee meeting, or would you like to address this right now as far as job requirements and its integration within the DSS?
We can address it now. I mean, the job, notice is going out. The, job, description has been approved by civil service with the changes. So, I think, I don't think that job description, will hamstring us in terms of however we want to do it. I know one of the recommendations was being answerable directly to the commissioner. Bob has since had a discussion wanting to have it directly answerable to the county chair, not county chair, the committee chair, with some supervision and support provided by DSS. Is that accurate?
That's accurate. I think that would be the better arrangement, given the different qualifications of directors who are directly in line at DSS to continue it as a county appointed position as an executive director, certainly getting any support it needs from us, but with a direct to the Health and Human Services chair and to the board at large. Seems to make sense. So I just wanted to make sure
Is there any precedent for that, for having an employee report to a supervisor?
That's the way it was.
It was quite previously?
That's the way our department heads do that now.
Okay.
But it's beneficial for that position to be located in DSS because of the support that DSS can provide their accounting department and clerical help, as well as office space. I mean,
and we will still provide that. And that's what I
I don't
had.
think we have to change anything. We just move forward. And as a committee, moving forward, we can talk about that further.
Okay. Well, thanks very much. That's what I had. If there are any questions, I'm happy to answer.
No, thank you, Commissioner. Any questions for Bob? All right, thank you, sir. Okay, last but not least, Director Almasi.
Good afternoon, everybody.
Hi, Dan.
It's like the first resolution that we have in front of you is a resolution to move budget dollars from 0.1 to 0.4. The background on this is that, as you may remember, we've had to use consultants extensively So it's come to a point where we need to transfer money from our point one to the point four to cover the costs of the consultants. So I ask for your support around this resolution so that we can be made whole in that regard.
I'll move it.
Second.
Discussion? All in favor? Opposed? Carried.
Thank you. The next resolution should have to do with create and fill, with the understanding that a position that already exists, we refer to it as the Twin Counties hybrid position, will be eliminated, and those funds will be used to cover the cost of this create and fill position, which will be a peer-based behavioral health care coordinator. We feel there would be a lot of value in bringing a person with lived experience on board in this sort of position, and their ability to capture revenue will be almost at the same level as the behavioral care coordinators that we currently employ at a higher rate in a higher title.
I'll move it.
Do I have a second?
Second.
Any further discussion? All in favor? Opposed? Carried.
Thank you. Next resolution is around a service agreement between ourselves, the Department of Human Services / the county, and Columbia Memorial Health. This is in regard to what's known as 730 examinations. These are competency examinations where they can be ordered by an attorney, either the public defender's office, the district attorney's office, or the judge presiding over a case can require that a person be evaluated in order to have their ability to participate in their defense determined. So this is something that the county has asked our department to take on as a responsibility. We gladly do that. Unfortunately, the evaluators need to consist of a psychiatrist and a psychologist, and at times a tiebreaker is needed. So we're just looking to contract with Columbia Memorial Health so that we can tap into their resources in terms of their psychiatrists there on staff.
Remove it.
Second discussion? All in favor? Opposed?
Yes.
That's does CMH get paid to do that, or?
Yes, I believe the rate that we're looking to agree upon or contract around is $200 an hour.
Okay.
We're just looking to cover their costs for the psychiatrist.
And is that typically a position they have filled? Because they have so many other things right now.
At Columbia Memorial Health, yes, I would expect them to have a psychiatrist available. They have Dr. Plotkin, they have Dr. Abdelhamid. They may even have someone in the emergency department, but I'm not sure.
Thank you.
And then the last two resolutions have to do with trainings. The first one is Jermaine, I can read my own handwriting, Galloway, also commonly known as the Tall Cop. This is a law enforcement officer nationally known throughout the United States who gives trainings and leads discussions around various levels of substance use disorders. One of the, and he was here in Columbia County approximately 5 years ago. This was extremely well attended. What he's known for is doing a phenomenal job of enlightening a community, general public, schools, providers about the nuances in how drugs are being used today. Simply put, the way drugs and alcohol were used maybe when I was a young person has vastly changed. There are young people and adults getting high in what he calls plain sight. They're abusing over-the-counter medicines and substances in ways that you and I would probably never fathom or think of. So he brings attention to folks like us as behavioral health providers so that we can recognize it, so that we can treat it, test for it, respond to it, etc. The cost of this is significant. It's an all-day training. His fee is $7,200 to fly in, I think, stay overnight, be on site for the full day training. We're providing lunch because it is a full day training, and there's a cost for the venue as well. I believe the total amount is some $9,200, give or take. This is coming from the New York State Office of Mental Health Development Funds and Training dollars. So this does not equate to an expense to the county. We're using state monies for this.
I'll move it. Second.
Thank you.
Further discussion?
How many people will be attending this?
It's being held at the college. The capacity there is 130. So, I wanted to thread the needle and not
find a venue, because they could have given us a venue for 400 some odd people, but given that COVID is on the uptick and all, I wanted to be sensitive to that. And I also didn't want to cover the cost of lunch for some 400 plus people. So I wanted to keep it reasonable.
100 people.
Yeah.
Give or take.
Yeah, I'm sure 100 will show up if we have 100.
Thank you very
Who's
much.
basically the audience?
Anyone. A portion of the audience has to be individuals from the Columbia County Mental Health Center, because that's why OMH is giving us the money. It's specific to our Article 31 clinic. But we have maybe at this point a dozen or so, well, more than that, clinical staff. But we're inviting the community. We're talking to superintendents about this, who are trickling it down to their principals, vice principals, guidance counselors. And, once it passes this home committee and our full board, we'll be putting out communications in the form of flyers to the community so that, residents can attend, anybody.
So it's a positive, it's a proactive outcome-based program.
That's a nice way of putting it, yes.
Okay.
I think anyone who attends will walk away having learned quite a bit.
Thank you, sir.
You're welcome. And then the last,
Did I have a motion in a second?
Yeah, you did.
Yes, I did. Did I have a vote?
You didn't have a-
Yeah, no.
Okay, all in favor?
Aye.
Aye, opposed,
thank you.
carried.
Then
What's
last,
that word discussion that?
Yeah,
Yeah.
that slowed us down a
That's
little.
so.
We had to fill up, right? Yeah.
Discussion.
so the last resolution is very similar. It's a training, not on the same scale. This is a gentleman who he's a behavioral health professional himself, and he also has lived experience. He is very open about his own diagnoses, and he incorporates that into his conversation and focuses in on the impact of bias and stigma and what his personal journey was like in terms of how he sought treatment to stabilize himself, get well, and so on and so forth. So this training, similarly to the previous one, is open to the public, to providers. Again, I'm encouraging as many of my staff as possible to attend. And even our clients, in this case, we're really encouraging them because they deal with, issues around stigma and bias, and that often has hindered them from seeking services to begin with. So we want them to hear this man's story. This is going to be held on November 15th at the Hudson Opera House. And that's just a half a day.
Do I have a motion? I'll move it. Second.
Very good. Thank you.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Right. And then the remaining items, I have the overtime report if you'd like me to run that down. But I also put on the agenda a conversation about the opioid settlement funds, which I'd like to bring to your attention. So do you want me to run down the overtime report real quick, and then we can go into opioid settlement fund conversation?
Sure.
In terms of our overtime report, it's very, very simple and minimal. We start out with a $12,000 amount. I believe we've used a total of $3,838.23, leaving us with a final balance of $8,161.77. So we had hardly touched what we projected in terms of an overtime report. So now, and I'm going to invite Commissioner Gibson to assist in this conversation, but I'll walk us back to, I believe it was last Friday, when a few of us were asked to present to the Budget and Finance Committee to make them aware of the opioid settlement dollars that Columbia County has been awarded. I believe it was several years ago now that Columbia County opted to participate in, was it one or several class action lawsuits? I'm not sure, but we participated in class action lawsuits, those that we've participated in, and there are others that are still looming and have yet to be determined. The outcomes have yet to be determined, but several have been resolved, and a determination has been made, and the county has been told that we are expected to receive approximately $2.2 million. The caveat here is that this money will be distributed over a lengthy period of time. We're starting to receive the proceeds as of this year, but it's going to be stretched out until 2038. So that's a pretty expansive period of time. Another caveat with regard to these dollars is that some come with restrictions in terms of how they can be spent and what they can be spent on. Others have no restrictions. The good thing about the restrictions is that they're very broad. So the restrictions will not be prohibitive, in my opinion. They rolled out a 14-page document of the restrictions, but after reading all 14 pages, I can assure you that we definitely have leeway in terms of how we would like to allocate these funds. So we've had a few meetings about it as a group, with county leaders and department heads and such, to organize ourselves. So far in 2022, I believe we received something like 400,000, maybe, give or take, and are expected to receive, I think it's 500,000. So we're still due some money in 2022. And then there are disbursements throughout 2023 all the way to 2038. Where things are at now, and the reason, a group of us met with Budget and Finance was basically to pose the question of how did Budget and Finance, and this is why I'm here today talking about this, because I would appreciate your feedback as well. Well, first of all, I want you to be aware of it. And if you do know about it, then I want your input in terms of how you would like us to proceed. Because now that we know roughly the amount of money that we're getting, and there may be other lawsuits that come our way, but right now it's 2.2 million between now and 2038. But the decision needs to be, well, what do we do with it? How do we allocate it? And we seem to have come to two directions, which we're, I think, going to approach maybe simultaneously. There are initiatives that the county is currently supporting, such as the Mobile Crisis Assessment Team. You all may remember we opted to help make them whole by Columbia County contributing $175,000, with Greene County contributing another $175,000 to help make them whole after DSRIP sunsetted and took their funding with them, so to speak. So that's something to consider. We have things like the Multidisciplinary Field Support Team. Just as a reminder, that's that program with the two staff, the two FTEs that are out there in the community and whose purpose it is to work with the high utilizers and really work very closely and mitigate any crisis that they may have, to keep that crisis as small as we can so that it doesn't flourish into something that rises to the attention of law enforcement, the courts, the jail, EMS, and kind of gobble up the dollars, the county dollars in that sort of way. There's also the MAT at the jail, which is coming in at a bit of a greater cost. We've contracted with Prime Medical. I believe everybody knows that. And there's an additional cost to that. So the proceeds from these lawsuits could go to those things and continue to subsidize them, and therefore avoid having to tap into taxpayer dollars. Or we could agree as a group, and you as county leaders, to say, we will figure out a way, whether it's taxpayer dollars or maybe ARPA funds, however long they last, or some other, form of funding to support those programs. And we will use the proceeds from the lawsuit to consider other initiatives that county departments may present, or that nonprofits in our community may come to us with and say, hey, we have this idea. We think this is how we can effectively impact those that were affected by the opioid epidemic. And we think we can really make a positive mark by operationalizing X, Y, and Z. So this was the conversation that occurred on Friday afternoon with the Budget and Finance Committee. I will tell you that the takeaway from that committee was that I was asked to organize a group of individuals to come together and, create a formula as to how we would invite the community, whether it's members of the community or nonprofits that currently exist in our community, to make their presentations, with the understanding, and this would be heavily emphasized, that there are no guarantees. Because again, $2.2 million sounds like a lot, but it's not. I think we can all understand that. The $500,000 that we're expected to receive in 2022 could easily be consumed by those county funded programs that I listed, the Mobile Crisis Assessment Team, MCAT, or the Field Support Team. So, it's really not a lot of money. And I just want to make sure that when we do create this process, that we communicate to those entities that offer up a proposal, that there's no guarantees. We want to hear them because they may have an idea that we've not thought of. So I welcome that, but I just don't want it to be thought in anyone's mind that just because they present a proposal, that it's going to be guaranteed that they receive some sort of funding to assist them in their idea coming to fruition. So,
Was the
Oh.
wellness center discussed at all, the funding for the wellness center?
in terms of what, for the opioid settlement dollars?
Yes.
It was something that I think I brought up initially. I was asked for, what I thought of as a list as the department head of the leading behavioral health provider in Columbia County and also as the director of community services. So that is definitely something, because there are elements of that that will cover its own costs, such as the detox. The detox will generate, reimbursement. So will the Safe Haven Homeless Shelter to a degree, correct, Commissioner Gibson?
But we have to get it built, right?
Sorry?
We have to get it staffed and running before we
Right.
get the money goes through.
Right. So there's that initiative is definitely, I wouldn't say on the distant horizon, but it's not close to the finish line. So, this is the conversation, Supervisor, in that, where do we want to allocate this found money? And where will it be most effective? And there are several opinions on that. Some people feel that we have to figure out a way to directly, positively impact those that were negatively impacted by the opioid epidemic, very direct and specific way. And then there's others, that may feel supporting something like the field support team or the wellness hub will have this residual effect that will be positive and beneficial to our community at large, which will in fact help those that were impacted negatively by the opioid epidemic. So there's multiple trains of thought, and I'm certainly open to all of them. And that's why we're creating this work group to figure out, how we want to organize this, how we want people to present their ideas to us. But I'd really like to hear from all of you in terms of, are you okay with that idea that was hatched at the Budget and Finance? Or do you have a stronger opinion about, do we just keep it simple and focus on, these initiatives that the county is currently funding? It's MCAT at $175K a year, and the multidisciplinary field support team was agreed upon by the county to be a pilot for 2 years.
With
At-
ARPA funds, correct?
With ARPA funds.
One was ARPA funds and one was with county funds. I forgot which one.
The multidiscipline team was the.
It was ARPA?
funds.
Okay.
So we're looking at, after the initial lump sum, we're looking at $140,000 a year for the next 15 years, basically.
Yes, you've done the quick math quite well, but it's not like that. I had the breakout schedule that I can share with all of you, but it's, for example, next year, we may get an amount that is much larger or much less than the following year. It's kind of hodgepodge. It's not, take the 2.2 million and it's equally dispersed over the number of years between now and 2038.
I believe it's based on scheduled payments by the companies who are paying, and it's.
Yeah, let's not forget, these are the pharmaceutical companies. They're quite diabolical in all of this. Call me paranoid, but they want to make interest off of the money that they owe us. So it behooves them to drag it out over as long a period of time as they can get away with. So.
And they'll pay us with yen.
Hmm?
So
Sorry?
they'll pay us with yen. Something different exchange rate. Sorry,
I don't know about
digress.
that.
I was just thinking about the same size payments over years, it kind of would look like a nice thing for a budget line where you could just tap it right in.
Right.
To the multidisciplinary.
Unfortunately, it's not that clean and simple as I understand it. Is that correct, Commissioner Gibson?
That is correct. I'll put this caveat out there. I hold out more hope than others. There's some folks in bankruptcy, including Purdue, a whole lot of asset. We are in on that. So I think there'll be some increase to those annuals, but we can't bank on that right now. And I'm optimistic that can build up, but they are not level payments throughout the time periods. So, that has to factor into.
Are you looking at this through the lens of unmet needs? Things that have we had to XYZ tool we could have done better, or Is that something we can do? I don't know how difficult that is.
Can you be more specific and qualify unmet needs? And
The wait time to get to somebody, if somebody needed help, we had staffing issues. The kinds of programs that we had available. I mean, I think bringing MCAT online is a great thing, but we were not the quickest to bring MCAT online. So
Right.
are there programs or staffing things that we should be looking at?
The best way I can answer that is, I don't know, because when you mention staffing, I get a shiver up the back of my spine
I'm sure,
because
yeah.
it's a challenge for every employer throughout the country, right? So I even brought that up in the meetings that we had. If a potential candidate makes a proposal and it's based on them identifying staff to operationalize whatever they're proposing, I will defer to the group that is in a process of getting organized, but that would make me uneasy because we'd have to say to ourselves, okay, we're all struggling to find staff. How are you going to secure staff to carry out this amazing proposal that, if we were able to find staff, would be incredibly effective, incredibly positive, very, beneficial, but it's dead in the water if they can't find the staff and they don't have control over that. That's beyond all of our control, as we've learned. We're trying all sorts of things. And actually, that reminds me, Kelly, did I forget one of the resolutions? CGI? I think I did.
No,
We did CGI
Yeah.
digital?
authorization. The contract with CGI Communications.
Okay, I don't think I talked about that one.
Matt moved it and Matt do seconded it.
Okay.
I been talking about this offline, but I'm just, when we were talking to the hospital last week or the week before, they were talking about staffing to the top of their job descriptions or performance levels. And I've been talking to young people. I have to learn some words more or finding the skill in the gap thing at the college. But I'm just wondering if some of these opportunities in terms of reshaping job descriptions would make the jobs more attractive and therefore easier to fill. I know that's a question we can't answer. And I know that staffing is a big issue, but to me, one of the things I'd want to look at is unmet program needs. How are program needs changed and how effectively are we meeting those changes?
Right. And I hear you because nobody feels that more than me in terms of, overseeing a Article 31 mental health center that can't open its doors as wide as I would like because of staffing. We're trying everything we can to fill these vacancies. That being said, we're still very restrictive at this time in terms of our admissions. We work with referral sources like the hospital, of course, probation, parole, the courts, etc. But if a member of the public knocks on our door, as they did quite often prior to the pandemic, unfortunately, our messaging to them is we can't accommodate them. And that's, a huge unmet need as far as I'm concerned. Yes.
How would the money be allocated to each individual that was affected by the opioid? How would it be allocated to each one of those? Because
If I understand your question correctly, I don't think that's what I'm proposing because
I
that
misunderstood you.
quantifying that would be extremely difficult. We've had, I forget the number, we just talked about it earlier today, but the opioid fatal overdose rate in Columbia County and Greene County, by the way, but I know we're here to talk about Columbia County, is still very concerning. It's on the rise, actually. And I wish I had different messaging with regard to that. That being said, I reassure myself and tell myself, well, okay, that's disheartening to hear that it's on the rise, but I can only imagine what that number would be like if we weren't doing everything that we're doing as a continuum here in Columbia County to try and keep that fatal overdose rate at bay. It's very depressing when you learn that all of your efforts, regardless of all of your efforts, the number is still rising in both of these counties, Columbia and Greene County. But I take solace in saying to myself, well, thank God we're doing everything that we're doing because that number would be double or triple. So to identify all of the individuals would be impossible to say.
I misunderstood you then. I thought it was that you had said that it would be allocated to those that were directly affected by the opioid.
As a population.
Sorry, I should have been clear. The population affected, are we talking about, the children that were left behind, orphaned as a result of? Are we talking about, the grandparents that are then raising the children that were orphaned because the parent or guardian is deceased or unable to adequately parent that person? The tentacles of this are so far reaching that it's almost mind-boggling, and we have to start somewhere. And that's really what I'm intending to attempt, which is to organize the invitation to the community in a way that is clear to the community, and then they can submit their proposals that this work group will then talk about, consider, and, I believe bring back to you as county leaders ultimately to give me guidance and say to me, Director Almasi, this is what you're recommending. Okay. And I'll tell you why. And then we'll have a conversation, and important decisions will have to be made at some point as to who gets the thumbs up and who doesn't.
And since we do have such a lack in staffing and wouldn't want to stress every individual area, I have ideas of where this money would be very useful, but I know we're shorthanded. In your opinion, where would it have the most impact given the lack of staffing where it would be utilized right away? You're talking about $900,000 this year. It's a lot of money.
This year, 500.
I just said another 400.
No, sorry. We have collected, I wish Jim was here. He could have speak.
Well, even 500.
But yeah, it's 400, I believe, is landed, and we're due another 100 or so.
That's
totaling
fine. So still
$500,000.
$500,000.
Exactly.
Where could that be utilized to give the most effect? I'd hate to say, oh, we're going to use it for this, but we need 6 more people to do that. And then we sort of, it's a great concept, and hypothetically it sounds great, but it's useless in my mind.
I mean, right.
Where
So
could we put it where that it could actually be utilized and it could give the most back to the community?
Well, off the top of my head, Supervisor Livonia, I think housing rises to the top, some sort of housing. There isn't any housing really for the folks that are most often affected by the opioid epidemic. They can't afford it. They're priced out. The units don't exist. All of these are in play, and there isn't a clear stream of money to offer itself up to, subsidize and bridge the gap between what a person may be receiving from some sort of entitlement and what the actual housing element goes for, the apartment, the 1-bedroom or the 2-bedroom, whatever they need if they're a family or something like that. There's got to be a way to help people gain access to the limited housing that's available and bridge that financial gap. I mean, that's just something that comes to mind right off the top of my head.
I don't know, is victim the appropriate word? I don't know what the word is to describe.
It's okay.
People. Have they been defined as a class? Do we know who's considered to be part of this group?
Not that I know.
Okay.
No, they haven't been labeled as such.
The parties to the lawsuit are typically municipalities, county.
But they're representing a group of people. I'm just wondering if we define those groups of people.
Well, we can certainly do that. It is the county entity itself that was the party.
I know, I understand that.
But you're asking more specifically, if this group falls under a certain label, is that right?
Yes.
Yeah, and labels are controversial, but useful in some instances. Right. And having a determination criteria as to what allows you to opt in and be identified as a victim of the opioid epidemic. Right. Whether that be you lost a family member, you yourself are struggling with addiction, or whatever the list may entail. Yeah. Right. I don't believe that's happened yet.
Dan, what about, we're in the.
Is that something we need to do? Do you think
Well, I think we need, I mean, this is at the very beginning stages. I think there's a lot of things we can take a look at. I mean, basically I'd ask him and Bob and Jack to come and just sort of introduce the topic to this committee. I mean, they presented to the budget work group. I mean, I don't think as a budget work group, we didn't formulate an opinion either way. We're gonna let the work group, meaning Dan's group and Bob's group, come up with some criteria and how we want to do this. But I mean, obviously with this, the Board of Supervisors approval and in terms of the outcome.
What, has anybody talked about, since we're in the process of hiring a new youth director in the county? Have we talked about, $500,000 was a long way in some sort of youth center, which, gets kids off the street and gets people maybe money that goes toward lease payments, right? It would last a long time.
Prevention.
Prevention and getting, to me, I think your concept of housing, that's very muddied and DSS already does a lot of that and very difficult to sort of try to figure out who should get it, who shouldn't get it, and how we disseminate the monies. But Columbia County Youth Center, we have $500,000. We lease something for $5,000 a month.
Well, so on the heels of that, Supervisor Ligonia, so there is what's known as the youth clubhouse. I don't know if any of you are familiar with that. I believe it's been talked about here on occasion, but this is administered through the Mental Health Association, and Kai Hillman is the director. He's a young person himself in sustained long-term recovery. He's very proud of that. It's not a secret. And Kai does a wonderful job. They have space in both Greene County and they had space in Columbia County, but I believe for some reason they lost it. I was just told that they have temporary space through Galvin, but they're looking for a more permanent home base. So along the lines of what you're hinting at, they could certainly use some help. And I heard the word prevention. So I don't know if everybody knows this here. I didn't come prepared with a bi-monthly report, but this would have been in that. The Columbia County Prevention Services has historically been provided by Catholic Charities under the auspices of Teresa Lux, the executive director. About 2 months ago that they were opting out after some 30 years of carrying that contract. I would be playing a role as the Director of Community Services and Local Governmental Unit to find our next prevention provider for Columbia County. We looked into it, and I was told that OASIS, the Office of Alcoholism and Substance Abuse Services, the state entity, would be taking lead on that. Now, I've been patiently waiting for word, and as late as I think was last week or the week before, I reached out to the OASIS rep and said, "Hey, do you have anybody in the prevention as we nobody in the queue?" The rep told me that they would definitely bring it to leadership at OASIS and get back to me. That hasn't happened yet. So to be honest, I'm getting a little nervous about us going into 2023 without a formalized prevention provider. But yes, to your point, Supervisor Ligonia, some of this money could, again, shore up and strengthen the prevention work, because when Catholic Charities was doing it, I think they only had 2 workers. I'm not sure if they were full-time. And they mostly focused on the schools, which is great because you have to start with the young people to, plant the seed of prevention. But there's a lot of prevention that could be done in the rest of the community and the rest of the population and with the adult population. So I assume that the focus was on children because the money only went so far. And that's where they felt they wanted to target their efforts. Executive Director Lux would have to confirm that, but that's my speculation. So if there was additional funding on top of the state aid that we get from OASIS to provide prevention in Columbia County, we might be able to bolster the prevention program. That's a great idea.
I just think you could do it for, almost in perpetuity. That's a lot of money. It's something that could go on and on and on and on. It wouldn't be something we'd run out of money in 2 years for something like that. I mean, There's a lot of planning and thought to go into it, how we would do it, who would run it, and how it would open. But
so sorry, go ahead.
That's it.
Well, this is the crux of the conversation. I mean, let's just notice and reflect on what just happened here in the past 15, 20 minutes. We went all over the map. And at some point, there will have to be a focusing of all of these thoughts and ideas in a way that we can live with and feel good about ourselves and deliver an impact that is effective and good for those that are receiving it.
Yeah, I mean, my take on it is, like I said, all, with everything the counties have been doing, you said the numbers are still spiraling upward. I think you really have to focus on prevention and, again, young people, different groups, who starts taking opioids, could be, somebody gets hurt playing athletics, there's a bunch of different groups that you could reach out to and make sure that you get in touch with and understand what the dangers of opioids are.
Right.
But also,
Just to slow or I would love to say, see a decline in use.
Right. Because the tragedy in all this, and I would love to end on a positive note. I see that we're near the top of the hour, but again, this is my own editorial. New York State just legalized marijuana. Personally, I'm very concerned about that. Americans, New Yorkers, they don't do anything in moderation. We don't embrace cannabis the way the European culture does, in my opinion. And I come from a substance use disorder background. I worry significantly about what that will create in our culture. We're going through a tough time economically. I don't have to explain that. People are going to be looking to medicate themselves and alter their emotional state in all sorts of ways. Tall Cop is coming. He's going to explain to us how people are, taking things off the shelves in Walmart, Target, any single pharmacy and manipulating the chemical composition so they can alter their mood. This is very concerning. Oh, and by the way, we're all talking about fentanyl, right? As a very powerful synthetic man-made opioid. There is stuff that the chemists are making as we speak for the cartels that are going to make fentanyl look like child's play. This is terrifying. So yes, prevention. I hear you loud and clear. So we'll just have to see and focus the conversation to a point where we can make a decision.
I just
I-
have.
but I was just gonna speak though, talk about the two forks. You would want to see the longevity of your multidisciplinary team and your MCAT team
Yes.
as well, too. So it's definitely be worth earmarking some of that funding to
Right.
make sure.
Exactly. That's the decision in terms of, do we want to fund what we have? And will there be monies left over to consider other projects? Do we want to acknowledge that we found money somehow, some way to cover the cost of MCAT and the multidisciplinary field support team? Because I can tell you anecdotally, I don't have the raw data yet, but the impact of the field support team is already showing itself in terms of cost savings. The amount of hospital diversion, EMS diversion, and law enforcement diversion that's occurred is remarkable. And I think Commissioner Gibson would support me on that.
But just a quick, can MCAT add fentanyl testing to their?
I believe they do. I would have to check with Katie Oldakowski, the executive director, excuse me. I think they do the Narcan training, and I'm going to double check about the fentanyl test strips. I know Carl Quinn's group, Greener Pathways, does that. We do that at the clinic. So that's really starting to get out there. One thing I want to leave you with about the Mobile Crisis Assessment Team, MCAT, is that myself and my counterpart from Greene County have been in conversation with Mental Health Association's executive director about getting MCAT positioned to start doing some billing. They have been Medicaid reimbursable for a while now, but that is a huge lift in order to structure your program, to get the billing people in there, to collect the information from the people in crisis so that you can bill, submit a clean bill, and get reimbursed. But we're working with David Rossetti, the new executive director, in terms of making that happen.
So the fentanyl test strip billboards that are on 9H, are those yours, Greener Pathways? Who's put those up?
Good question. Does anybody know? I don't think they're through. They're not through the Department of Human
Are
Services.
they going through that program? That is a good question. I know that was one of their initiatives.
It might be through the Healing Communities Study. There might be funding through
Very
that.
obvious and colorful. I mean, they look very effective.
They're eye catching. Yeah.
So I want to return to Denal's question. About the two pathways, they're not mutually exclusive. We could find a way to do, if we chose, we could find a way to support existing programs as well as maybe set aside something for newer programs.
Right. That's
That's the bad.
part of the conversation.
Okay. My question is, who's gonna break this down to, because you, like, everything that we talked about in here, you know, all the stuff that's been thrown out, the stuff that you brought to the table. Who are the people that are gonna break this down to bring it to the board for approval of what's gonna be done with the money? What is it an anticipation, like anticipated date? How long is this gonna take? Are we gonna throw this back like 6 months from now? Are we gonna say, well, we talked about this 6 months ago and we never got anywhere? Or is there going to be formulation of something? Because you've been assigned to do something with, to go out to the public. And staff is
Well,
already an issue with
my-
that, so.
The way I see my task ahead of me is to organize the work group.
Yeah.
The work group will then decide what the boundaries of all this will be as far as the proposals that we're looking to receive. And yes, there will have to be not a marketing campaign, but an informational campaign to the community to say, and I'm in a good position to do that because I interact with the executive directors of, you know, most of the nonprofits on a daily basis.
For what you do, yes,
Mhm.
but the whole question is, who's gonna be the determining factor? What people, you know, it's gonna be brought to the board of supervisors at
Can
some
I,
point.
if
Yeah,
I
yeah.
could, I would say that the lead it would be our county department heads.
Okay,
Dan Almasi, Bob Gibson, and Jack Mab.
okay,
Jim Bragg, our financial person. And, you know, working, you know, and I'm not saying Jim has to go to the meetings, but Jim would need to, you know, verify the numbers. And they would come back and make recommendations to us.
there you
with
go,
a
that's
plan.
what I'm.
Right. Yeah, that's the plan
That's
as
who
I
are the
understood it.
people,
So
who are
thank
gonna be
you.
the key players in this?
Me, Bob, Jack, Jim,
Good,
and yourselves.
there you go, yeah.
Kathy.
We get it, we broke down,
And
here you go, this is what we
you're
wanna
gonna
do.
reach out for the work group and who you want.
I've started to
Good.
put some feelers out there. We're trying to organize a meeting. So that's already in play.
Yes.
Thank you.
All right.
Any
Thank
further
you.
questions?
Appreciate your time as always. Thank you very much.
Thank you.
Thank
Dan.
you.
Dan. Appreciate it.
Or nothing. Yankees.
Oh, that's right. The game was today. Got rained out.
All right, anything further to come before the committee? I'm gonna ask for a motion
I'll make that one.
Second.
to adjourn. All in favor?
Thank you.
Aye.
Bye now. Where is, feel better.